As the field of regenerative medicine expands, it becomes increasingly important to understand proper models to use in a laboratory setting. The African spiny mouse is a fantastic model for this, as it is the first mammal known to exhibit regenerative healing without fibrosis or forming scar tissue. Studies have shown that psychological stressors can impact regenerative healing and, in some cases, even lead to fibrotic scarring. Psychological stress is often associated with injury, and as regenerative medicine develops as a field, it is essential to have a comprehensive understanding of the effect of social stress on regenerative healing in order to combat this in a clinical setting. In spiny mice, one common source of stress that they face is social stress, which often goes hand in hand with dominance status. Typically, the dominance relationship between mice in a cage is studied using active agonistic or dominant behavior, such as chasing, and active social avoidance or subordinate behavior, such as fleeing and freezing. However, studies have demonstrated that spiny mice tend to have low levels of active subordinate behaviors in comparison to other species of mice. Because of this, we must expand the definition of social avoidance behavior in order to gain a more complete understanding of the social stress individual spiny mice undergo and how that relates to their regeneration. We hypothesized that social avoidance could be linked to duration spent in various locations around the cages, and also that the more dominant individual would have a faster rate of regeneration. For example, if a dominant mouse moved freely around the cage, but the subordinate mouse stayed in the same place the entire time, or even actively moved to avoid the dominant mouse, this can help to indicate social avoidance in a more subtle way than the explicit actions of fleeing and freezing. In order to study this, we first established the dominance rank of 3 pairs of spiny mice using active agonistic and social avoidance behavior as a guideline. Using these 3 cages, we then set up an observation spanning over the course of 3 weeks to track their duration in different locations within the cage. We also analyzed the regeneration of a 4mm biopsy punch in each mouse's ear and compared that to their dominance rank. What we found was that, across every cage, the dominant mouse displayed a faster rate of regeneration. We also found that time spent in each location tended to vary more within the cage than between the cages, and did not display a consistent pattern across the board. For example, although in cage 2 the subordinate mouse spent more time in the top left of the cage than the dominant mouse, this pattern did not carry through to the other cages. Additionally, cage 3 had a less defined dominance relationship than the other cages, and analysis showed both mice in this cage spending roughly the same amount of time in each location. This could indicate that, if the pairs have a very clear dominance ranking, there is more likely to be a separation of locations, but more study is needed to confirm this. Moving forward, it is important to continue to establish a more expanded definition of social avoidance behavior, and to take a deeper look into the ways social stress plays a part in regeneration rates. Psychological stress holds such a crucial role in the future of regenerative medicine, and understanding the African spiny mouse is a great place to start. Thank you.